I'm gonna wash my hand. So Mr. Peter Pitt, 72 years old male, presented to the hospital post-trauma, hit by a car. Was walking, patient crossing car, reportedly traveling 40 km per hour, injured ribs right side, abrasion and wound to the left leg. And patient 72 hours post admission, full primary and secondary survey attended, PCS seized, and commenced BD per oral 7.5 mg oxycodone, 4 times a day per oral 1 gram paracetamol as well. Okay. Now I'm going to see the patient and we'll be checking my first patient check as well. Could you please be my patient?
Sure.
Hi, Mr. Peter Pitt. How are you today?
Not so good.
Oh, okay. Peter Pitt, my name is Gagan and I'm a student nurse looking after you today. Doctors ordered oxycodone, which is a pain relief for your pain. And so for this thing, I need to ask you a few more questions about your details, about the patient details. So could you please tell me your full name and date of birth, please?
Sure. Peter Pitt, and the date of birth is 1/1 of 1945.
Okay. So may I check your armband, please?
Sure.
Peter Pitt, 1st of 1st 1945, 1st of 1st 1945, MR number 123754, 123754. Alright, Peter Pitt, do you have any allergies?
I'm allergic to penicillin.
Penicillin. What happens when you have penicillin?
I usually get rash.
Well, I can see the red band is here, so it indicates that you're allergic to something, means it's a penicillin. Yeah, doctor is also signed and printer name is here. Before I proceed, Peter Pitt, I need to ask a few questions about your pain score, about your pain assessment. So could you please tell me your pain score out of 10? 0 means nil pain and 10 means the worst pain. Could you please tell me the pain score?
It's 8.
Oh, it's quite significant. And where is the pain? Where is the location of the pain?
It is on the chest.
Okay. And how long it's been you're having this pain?
From the last 15 minutes.
Okay, no problem. And one more question. Is it localized or does it radiate?
It is localized.
Okay, no problem. So Peter Pitt, another question. Before I proceed, I need to check your vital signs.
Sure.
The reason being is the vital signs, I'm checking vital signs because of the medicine oxycodone. And oxycodone, this is a medicine which causes respiratory depression, which means it can cause lower your respiration rate, and it may cause lower your blood pressure as well. So I need to make sure all the vital signs are within the flag.
Go ahead,
so
please.
may I check your vital signs, please?
Sure.
Okay. So so Mr. Peter Pitt, I've checked your vital signs. All the vital signs are within the flag. So I'd like to proceed now. I'm happy to proceed. So is that okay if I come back in 5 to 10 minutes?
Sure.
We'll get your medicine, and in the meantime, there's your buzzer. If you need anything that concerns you, I'll be answering you anytime. So just wait for me. I'll be back.
Thank you.
All right, Peter. I'm gonna wash my hand now. Nurse, could you please be my second RN for the validation of my medication order?
Sure.
So I've got right patient, Peter Pitt, 1st of 1st 1945, MR number 123754. I've checked with the patient. He stated that he's allergic to penicillin. I've checked with the red band as well. He develops rashes. Doctor has signed here, print name is here. So, and for his pain, which is quite significant, he stated that. So for his pain, doctor charted oxycodone. It's charted on 4th of 4th 2018, which is current and within 7 days. Route is per oral. Dose is 7.5 mg. Frequency is 2 times a day. Indication is pain, and doctor signed and print name is here. Contact number is 169, and it's due at 8 o'clock. It hasn't been given yet. So are you happy with my validation order?
Yes, please.
I've got patient here as well. Okay, so I'm gonna look this medicine into the MIMS just to check the nature of the medicine. So that's oxycodone. Okay, so I've got oxycodone tablet, oxycodone hydrochloride. It's used for opioid analgesic, modern to severe pain, modern to severe chronic pain. Contraindications are opioid hypersensitivity, acute respiratory depression, acute asthma. Precautions are hypothyroidism, opioid dependence, hypotension, hypovolemia, biliary tract disease. And adverse effects are tolerance, dependence, GI upset, including constipation, dry mouth, chills, fever. Um, um, the maximum dose, recommended dose is 5 mg per 6 hourly, and in our case it's 7.5 mg recommended by the doctor because of the severity of the pain, and also its route is per oral. And another thing, the nursing management, we need to take the vital signs before the administration of the medicine, and after the 15 minutes of the administration of the medicine, oxycodone. So I'm happy with the medicine. So would you please be my second RN one more time for my further drug checks?
Sure.
Okay, I'm going to the DD cupboard. The first thing I like to do, I like to check the total count before I proceed this. So I'm concerned with Endone. Okay. So I need to count the medicine, therefore I need kidney dish. I got everything out because I'm gonna use it in further. It's locked. So I've got a Endone oxycodone hydrochloride. So according to the balance, it should have 14. So let's see the count number. Could you please check with me the count?
Sure.
So it should have 14. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So are you happy with the balance? Because we should have 14.
Yes, please.
Okay. Now I'm gonna keep my medicine, the tablets like this, because I'm further gonna dispense it. So now I like to do my first drug calculation. Would you please be my second RN to do my first drug check?
Sure.
So I've got a right patient, Peter Pitt, date of birth 1st of 1st 1945, MI number 123754. I checked with the patient. He stated that he's allergic to penicillin. He develops rashes, and I've checked with the red band as well. So doctor has doctor's sign and print name is here as well. So doctor has prescribed oxycodone. I've got oxycodone hydrochloride, and it's started on 4th of 4th 2018. It's still current and within 7 days. Route is per oral, tablets per oral. 7.5 mg 2 times a day. Indication is pain. Doctor's signed and print name is here 169. It hasn't been given yet. It's due at 8 o'clock, and the expiry date is December 2020. So I'm happy to go. So are you happy with the first drug check?
Yes, please.
Okay. So now now I'm going to do my calculations. So it's stock required over stocks turned into volume over volume. I've got 7.5 mg over 5 mg into 1. It gives me 1.5 tablets. Are you happy with my calculation? So
Yes,
now
please.
I'm going to do my second drug check. I've got right patient Peter Pitt, date of birth is 1st of 1st 1945, MRI number 123754. I checked with the patient. He stated that he's allergic to penicillin and he develops rashes. I've checked with his red armband as well. So doctor signed here and the print name is here as well. So oxycodone hydrochloride, charted on 4th of 4th 2018, still current and within 7 days. Route is per oral, tablets per oral. 7.5 mg dose, frequency is 2 times a day, indication is pain. Doctor signed and print name is here. Contact number is here 169. It's due at 8 o'clock. Hasn't been given yet, and expiry date is 2020 December 2020. We can still use it. So now, I like to dispense my medicine. Before touching the medicine, I like to wash my hands. It includes the policies. So according to my calculation, I need 1.5 tablet. So I have 1 tablet, and I've got my pill cutter here. So I need half tablet. So I'm gonna use half tablet here and going to discard half tablet. So now I'm going to do my third drug check. I've got patient Peter Pitt, MRI number 123754, date of birth 1st of 1st 1945. I've checked with the patient. I've checked with the patient. He stated that he is allergic to penicillin. He develops rashes. I've checked with the armband. Doctor signed and print name is here. Doctor is charted oxycodone for his pain relief, for his pain. It's oxycodone hydrochloride, charted on 4th of 4th 2018. And the route is per oral. Tablets. 7.5 mg is the dose. Frequency 2 times a day. Indication is pain. And doctor signed and print name is here. Contact number 169. Due at 8 o'clock, hasn't been given yet. And expiry date December 2020. So now I'm gonna do my balance again because I dispensed my medicine. So according to the calculation, I should have 1.5 tablets. I took 1.5 tablets and half tablet discarded. So now I should have 14 tablets left out of 16, or actually 12 tablets. I should have 12 tablets left now because I took 2 tablets, half is discarded. Could you please count with me? 1 2 3 4 5 6 7 8 9 10 11 12. Are you happy with it?
Yes, please.
Okay, so now I'm going to fill the information in it. Today is 4th of 2018, 8 o'clock. Patient name is Peter Pitt. I'm going to use 1.5 tablet. Balance is Dr. Speed Brown. That's my name. Could you please sign here for me if you're happy with the count?
Sure.
Yeah.
So Peter Pitt.
Okay. Now I'm going to put the medicine back in the container because we are agreed the count is okay. Going to open the cupboard. Medicine pill cupboard. So I'm making sure it's locked. It's locked. Going to wash my hand. Before washing hand, I like to put this book here. Gonna wash my hand. I'm gonna wash my hand and going to do my second patient check. Hi, Mr. Peter Pitt. I'm back again with your medicine ready. So before I proceed, could you please tell me your full name and date of birth one more time?
Peter Pitt. Date of birth is 1/1/1945.
May I check your armband, please?
Sure.
Peter Pitt, 1st of 1st 1945. MR number 123754, 123754. Peter Pitt, are you allergic to anything?
Penicillin.
Okay, so what happens when you have penicillin?
I usually get rashes.
Okay, so I can see the red band as well, which indicates the patient is allergic. Okay, that's not a problem. So I've got a medicine oxycodone, which is not related to penicillin at all. And so this medicine may cause nausea and vomiting, which is a side effect of the medicine, and and dizziness sometimes, and sometimes dizziness. So I'm gonna give this medicine with water. So could you please have this medicine in front of me?
Sure.
Okay. So I'm gonna discard it. So now I'm going to wash my hand. Peter Pitt, all the procedure has been done now. You have had your medicine, which will help you to relieve your pain. Now I'll be coming back in 15 minutes to check your pain and to check the vital signs. In the meantime, this is your buzzer. And if something concerns you, please let me know. I'll be back in time then. So thank you so much.
Thank you.
So could you please come over here and sign for me?
Sure.
So today date is 4th of 4th. This is the medicine. 8 o'clock. Could you please sign here for me? Thank you so much.